This is a presentation on dementia prevention using nutrition by Karen Hogan. In this presentation, you will learn the background of dementia, including the 5 most common types, the history and demographics of dementia, what causes dementia and how it is diagnosed, signs, symptoms, and current management of dementia, and the role nutrition plays in dementia prevention and intervention. Dementia is a broad term for a whole range of conditions that affect the brain. There are more than 200 subtypes of dementia. The 5 most common types are Alzheimer's, vascular dementia, dementia with Lewy bodies, frontotemporal dementia, and mixed dementia. I will get into the details of those later in the presentation. Generally, dementia is an impairment in thinking, remembering, and reasoning to the extent that it interferes with a person's daily living. Dementia is the main cause of disability and dependency in the older population. It has serious detrimental psychological, social, physiological, and economic impacts on those afflicted with the disease, as well as their families and caregivers. Dementia has been around for a really long time. The word dementia comes from the Latin root demens, which means being out of one's mind. Dementia showed up as far back as the 13th century. By the 18th century, the term dementia included a lot of psychiatric and neurological conditions. By the 19th century, people with dementia were recognized as patients who needed medical care from specialists, and this is when senile dementia became a medical disease. Between the 30s and 50s, dementia was reframed to be thought of as a psychosocial problem instead of a brain disease, and this was because they started seeing inconsistencies between the clinical manifestations of dementia and the pathological findings. This was best explained because different people's brains compensate in different ways depending on the type and extent of the brain damage. Between the 40s and 50s, they discovered that if they could keep elderly people active and engaged, their mental abilities and independent quality of life could be maintained for much longer, which put less stress on their caregivers and the healthcare system. In 1965, the Older Americans Act created the Medicare program, and this was possible because of the reframing of dementia as a psychosocial problem back in the 30s and 40s. By the 1970s, the elderly people enjoyed improved economic status thanks to the Medicare program, and dementia became a major public health issue. By the 1980s, Alzheimer's became a household word and started getting more research. Research continues today for dementia to try to find a cure and provide more resources for those suffering from the disease as well as their caregivers. Dementia is a worldwide problem, with 47.5 million people affected worldwide. This number is expected to continue to grow and reach 135.5 million by the year 2050. Most of the people that are affected are over 65, with 9.5% of men and 10.1% of women being affected. One reason dementia affects more women than men could be because women simply live longer than men and have more opportunity to develop dementia. We see dementia getting more prevalent as people get older, with only 4.9% of 70 to 79-year-olds suffering from dementia, 16.1% of 80 to 89-year-olds, and 30.6% of those 90 and older. We also see that dementia is more prevalent among the Hispanic population, with only 8.4% of white people being affected, 12.7% of Black people, and 17% of Hispanic people. We also see dementia is more prevalent in those less educated, as it affects 18.9% of those with no high school diploma and only 5.6% of those who graduated from college. Now we're going to go over the 5 most common types of dementia, starting with Alzheimer's disease. There are a few causes of Alzheimer's disease, one of which is a mutation of genes that are passed from parent to child, one of which is the apolipoprotein E4 allele. Alzheimer's is caused by plaques and tangles which form in the brain of those afflicted with the disease. The plaques and tangles are probably caused by damage to the brain from high blood pressure or poor diet, lack of activity, or environmental toxins, and these plaques and tangles damage healthy neurons and fibers that connect them. The symptoms of Alzheimer's are memory problems, which progress to forgetting to take care of themselves and eventually not recognizing loved ones. Vascular dementia is caused by damage to the vessels which supply blood to the brain. This can cause strokes or damage the fibers of white matter in the brain. The symptoms of vascular dementia are difficulty in problem solving, slowed thinking, and loss of focus and organization. Lewy body dementia is caused by an abnormal balloon-like clump of protein in the brain, which is called a Lewy body. These are found in the brains of those with Lewy body dementia, Alzheimer's disease, and Parkinson's. The symptoms are acting out dreams in their sleep, seeing things that aren't there, problems with focus and attention. In Parkinson's, symptoms are also uncoordinated or slow movement, tremors, and rigidity. Frontotemporal dementia happens when there is a breakdown of nerve cells and their connections in the frontal and temporal lobes of the brain, which is where personality, behavior, and language are associated. Symptoms of frontotemporal dementia are behavior and personality differences, difficulties with judgment, problems speaking and understanding language, and uncoordinated movement. And last on our list of the 5 most common types of dementia is mixed dementia, which is really common in those with dementia. A lot of people have several causes, such as Alzheimer's, vascular, and Lewy body dementia. To diagnose dementia, a physician needs a detailed historical evaluation for cognitive decline, showing a loss of cognitive abilities in more than one domain, which could be the memory area, language, visuospatial, or executive functioning. This history can come from the person with dementia, as well as a close family member or friend who are familiar with them, and can also attest to a decline in the previous level of functioning. The patient also needs a thorough mental status examination, including language, attention, visual, spatial, cognition, executive function, and mood. If these assessments are inconclusive, then neuropsychological testing can decide if the person has dementia. Dementia happens when there is damage to or loss of nerve cells and their connections in the brain. This damage can take years and years to build up and start out presenting as cognitive decline and then progress to dementia. Things that cause this damage will be discussed further in the presentation. Different areas of the brain can be damaged and affect people differently, which is why there is a vast variety of symptoms people can experience. Some non-modifiable risk factors which can cause the damage in the brain leading to dementia are the genetic risk factor of the previously mentioned polypoprotein allele, being elderly, 65 years and older, and also being female, as was previously mentioned. Some risk factors that we do have control over are being physically inactive, smoking, hypertension, obesity, diabetes, depression, low educational attainment, and some nutritional areas are eating a diet high in saturated or trans fat, a high sugar diet, not eating enough fruits and vegetables, or not getting enough fiber. Some of the symptoms of dementia are memory loss, poor judgment, confusion, problems speaking, understanding, or expressing language, difficulty with reading and writing, wandering or getting lost, problems with money, repeating questions, using unusual words to refer to familiar things, taking longer than normal to perform tasks, losing interest in normal activities, hallucinating, being impulsive, disregard for other people's feelings, and balance problems. There is currently no cure for dementia, and so the goal of management of dementia is to reduce suffering caused by cognitive decline in its mood and behavior symptoms while delaying the progression of the disease. Pharmacological management includes these 4 different drugs which have modest benefit, but they also come with adverse side effects, including nausea, vomiting, loss of appetite, and insomnia. Non-pharmacological management includes referral to specialists such as geriatric nurse practitioners, social workers, and occupational or speech therapists, cognitive training and reading or playing cognitively engaging games, music or art therapy, psychotherapy, physical exercise like walking, swimming, and resistance training, social activities, eating a Mediterranean diet, getting adequate sleep, making sure that the person is in a safe environment, and keeping good communication open. It is important to note that malnutrition makes dementia worse, with higher hospitalization rates and increased mortality. When working with dementia, it can be helpful to realize that throughout life, the brain requires a certain amount of energy and nutrients so it can develop normally as we're children and function optimally as we're adults. Two factors can affect this development and functioning of the brain: genetics and our environment, including nutrition. Some vitamins and mineral deficiencies that can affect brain function are vitamin D, vitamin A, folic acid, iodine, and iron. The bigger and longer lasting the deficiency, the faster the cognitive decline and the greater the dementia risk. If it's caught early and proper nutrition is consumed, some of the damaging effects can be reduced. However, reversing dementia is almost impossible once it has been diagnosed. To lessen your risk, it's important to note that there's growing evidence that introducing or maintaining a healthy lifestyle, including adequate nutrition, can improve symptoms or delay the progression of dementia. Higher levels of vitamin D, adequate fruit and vegetable intake, or a Mediterranean diet lower the risk. Get and stay active, because being sedentary is significantly associated with an increased risk of dementia. To decrease your risk of getting dementia, get adequate vitamin D, eat your fruits and vegetables, protein and fiber. Try a Mediterranean diet, because the benefits of a Mediterranean diet are it reduces inflammation, it contains nutrients which lower LDL cholesterol, and it lowers levels of the C-reactive protein interleukins, which high levels of those can increase the risk of dementia. It also adjusts glucose and lipid metabolism, which improves insulin sensitivity and blood lipid profiles. And it's high in these antioxidants, which have been shown to help reduce incidence of dementia. Some dietary things that increase dementia risk are eating a high saturated trans fat diet, high sugar diet, not getting enough fiber, and not getting enough vitamins. The reason a high saturated trans fat diet can lead to dementia is it increases LDL cholesterol, which speeds up atherosclerosis and promotes blood clot formation. This reduces blood flow, which can cause mini strokes, which cuts off oxygen to the brain. This can lead to damage to the neurons, which are responsible for memory, language, and thinking. It also increases insulin resistance, which can lead to type 2 diabetes, which is another risk factor for dementia. There is epidemiological evidence that diets such as the Mediterranean diet have significant cognitive benefits in the elderly population. However, there isn't sound supportive evidence that it reduces the risk of dementia. We just need more research. The Mediterranean diet consists of fruits, vegetables, whole grains, legumes, nuts, seeds, olive oil, and fish. The Mediterranean diet provides many nutritional benefits, including bioactive compounds like carotenoids and polyphenols, as well as antioxidants, which lower systemic inflammation. All of these help keep the brain healthy and lower dementia risk. Throughout this presentation, you have learned the background of dementia, including the 5 most common types, the history and demographics of dementia, what causes dementia and how it's diagnosed, signs, symptoms, and current management of dementia, and the role nutrition plays in dementia prevention and intervention. Here is a list of references I used to create this presentation, and some more references. Thanks for watching.